Hello, we are going to demonstrate proper use of a mask. So we want to go through this. Savannah is going to demonstrate. So one thing, always make sure you wash your hands before and after handling your mask. Otherwise, risk reinfecting yourself. So also, when touching the mask, always make sure you touch the loops, not the mask itself. When taking it on and putting it off, lean forward and scoop the elastic bands behind both sides of your ears without touching the mask portion, just the elastic portions. When removing the mask, treat it as if it's soiled and always have a designated storage area till it's clean, so don't risk infecting yourself if in case there's anything there. Keep the mask as sterile as possible. So touch the inside of the mask as little as possible, especially when you're removing the filter. Showing the filter piece right there. All right. Other than that, make sure that when you're use gloves when you are going to replace the filter for your mask, because you need to keep everything sterile. Make sure that you replace the filter once it becomes wet with your breath or any other reason. It will no longer filter out the particles once this becomes wet. Once you have been exposed to somebody, your filter, you should replace your filter every time you're in contact with a symptomatic person. Lastly, over here, store your mask in a ziplock bag or in another sterile container between uses. Do not just leave it around because it could become contaminated. Also, at the end of the day, dispose of the filter and wash the mask in hot soapy water and allow to air dry, okay? All right, these are the do nots for your filter and your mask, okay? Do not touch the front of your mask unnecessarily. Do not touch the inside of your mask unnecessarily, it contaminates it. Do not touch the mask with dirty hands without washing your hands first, because again, it will contaminate your mask. Never use a wet or damp mask. Even when you have it over your mouth, your breath will bring condensation, which will reduce the effectiveness over the period of time. All right, do not leave your mask hanging off of one ear. Also, do not leave your mask hanging off of both ears under your neck. Do not leave your mask lying around at home or in your office or on your desk, just somewhere, because that is not a sterile location. And lastly, when you're wearing your mask, do not touch your mask and then, for instance, touch the rest of your face or your eyes, or be unnecessarily adjusting your mask. Otherwise, you might contaminate yourself. All right,